Okay, so welcome everybody. Welcome back to Genius Class 2023. Okay, so let's look at our next scenario. So the next scenario we'll be looking at is the head lice. Okay, so let's share the screen and have a look. Here we go. So head lice is the next scenario we'll be looking at. Okay, just going to play the presentation. Okay, so here we go. So let's look at the background information. So our next scenario, one more time, is the head lice. So background information, you're an FY2 in a GP surgery. A 45-year-old man has made a phone call appointment to talk to you. He is concerned about his 5-year-old daughter. What you must do is to talk to him and address the concerns. Now, for the past 4 weeks, he has noticed that his daughter has got a head lice. Okay. And his opening sentence is, "Doctor, my child is having problem with head lice." Good. So he has tried over-the-counter shampoos, but it keeps recurring again. Okay. So the child is scratching the head. He has noticed that the head lice goes away and comes back from time to time. He is reluctant to bring the child to the GP surgeon. His main concern is, can you prescribe her some medication? Can you prescribe her some medications? Approach to this particular task. One is grips as usual, the introduction, nice, friendly smile. As we always say, you have to smile to develop a rapport. Then you're going to take the history of the presenting complaint. Yeah. So what questions can we try? What makes you feel that she has got a head lice? Have you seen the lice? Okay. And is there itching? Okay. And how long has the child has the symptoms for? Or how long have the symptoms going on for? Have they seen any live lice? And have they seen any maybe eggs of the lice? Okay. Remember, it's important to see the live, head lice in order to treat. Okay. Now ask about the possible source. Is there anyone in the family with head lice? Has she slept at any other, maybe a house or place? Okay. Visiting some other places, or maybe other visitors coming in the house. Okay. Where do you think she could have caught the lice? So which means this is what? Ideas, okay? Do you have any ideas, or where do you think she could have caught this lice? Have you had any visitors recently visiting your house, or has she been maybe away, staying at other people's place, or maybe school, for example? Do you know if there's anyone at school with head lice? Yeah, first, of course, we need to ask, does the child go to school? Okay. Then we can say, do you know if there is anyone? Do you know if there's anyone with the head lice at the school? Okay. So then we can ask those particular questions. Good. Treatment, have they tried anything? What treatment have you tried so far? Did it help? Okay. Now, is there anyone else at home? Who else is at home? And was everyone else treated at home? Remember, everybody, the whole household needs to be treated. What are the differential diagnoses? Seborrheic keratitis, not keratosis. Okay. Seborrheic keratitis. Okay. Okay. Can cause some whiteness scales in there that you can confuse with the head lice. Eczema as well. So we need to consider that if there is any rashes on any other part of the body. So ask, yeah, have noticed any rashes on any other part of the body, and of course, do systemic review. Yeah, any joint pain. Okay, any swellings anywhere. Okay, this is seborrheic dermatitis. Sorry, my mistake. Yeah, seborrheic dermatitis there, guys. Yeah, just make sure you correct that. Seborrheic dermatitis, eczema, a systemic review just to check it. Has the child been well recently? Any fever, any rashes anywhere, any pains anywhere becomes crucial here. Okay, good. Then you complete the other history. P. maftosa, ice. Remember the ideas we asked already. Do you have any ideas? Where you think the child could have caught this head lice? Okay, and how has this affected the child generally? Okay, then pediatric history as usual, child development, growing well, up to date with all vaccinations, eating and drinking well, problems during pregnancy. Yeah. pregnancy, delivery, all those basics we need to do. Yeah, pregnancy, delivery, we need to be asking. Yeah, good. Social life. Who else is at home with you? And what about the mother? Ask, okay, where is the mother? Okay, are there any other children at home? Now, okay, and is it possible to bring the child so that we can examine the head and see if we can visualize the head lice? Okay, now it's important also in here, as we know, head lice is part of poor, we need to ask about, child abuse. Has child protection services ever been involved in your child? Yeah. Have the social services or child protection services ever been involved in your child? Yeah, that's important to ask. Then at the end, we take the history, we explain the diagnosis. We're gonna say it could be a head lice, but it could be other things as well. Explain that there are other infections that may present like a head lice, and it may be difficult to differentiate. It is therefore important to bring the child to the GP's practice for examination so you can visualize a live head lice. Okay, because remember, we need to arrange a face-to-face appointment to examine the child, because treating head lice involves if you treat the person only if live head lice is found. So explain to them that generally treatment is advisable if we can see the live head lice. So this is why you'd like to arrange an appointment for them to come and see, so that you can review the child and examine the child. Okay, treat the affected household, and also if there are other members in the family, you need to explain they need to be treated. The father himself need to be treated. So the reason the lice is going and coming back is recurrent. One of the reason is because he himself was not treated, and if there's somebody else in the house was also not treated. So treat the affected household members simultaneously at the same time. Okay, good. Now, the child, may ask you, does the child need to stay away from school? The child who is being treated for head lice can still attend the school. There is no need, to exclude you from school. So you can continue going to school, and there is no need of washing clothes or beddings that has been in contact with the lice. Okay, good. So it's about treating the whole family members, and then it can go away completely. Okay. Now, what method can you try? Well, wet combing the hair, of course, wet combing of the hair. Now, systemic combing of the head to remove the lice from the head. Now, generally head lice removal, there are some kit called bug buster kit that can be used to remove the head lice. And usually you need 4 sessions bug buster kit to use maybe on first day, then on day number 5, day number 9, day number 13. Okay, so what other options here? Insecticide. You can use insecticide to apply in the head like silicone. Chemicals or traditional insecticide. Yeah, chemicals such as what? Melathion. So in this particular case, we prescribe something. We can prescribe melathion 0.5% for them to apply. Okay, so treatment needs to be applied to all areas of the scalp and all the hairs. All areas of the scalp and all the hairs. Melathion 0.5% we can apply. Okay, good. But remember, the whole family needs to be treated. Okay, so there are several options here, as you can see. You can use the insecticides, you can use some chemicals. Yeah, how do they work? They poison the lice by chemical means. Yeah, so you apply melathion to the whole scalp, the whole hairs, and everybody in the family needs to be treated in the same way. Okay, good. Now, in some situations, wet combing, if it's a pregnant woman has got a head lice, usually wet combing, or this medication in here, okay, dimeticon 4% lotion is a recommended one, not the other ones, okay? But in this case, we don't have a pregnancy situation. Yeah, good. So now it's important to tell them about the treatment failure, that everybody in the house has to be treated, okay? So failure of the treatment could be due to the fact that not all family members are treated. Okay, they should be. If a treatment has failed, so you're gonna offer them maybe melathion 0.5%, treat the whole family, okay, to the whole scalp, to the whole hairs. If that fails, then we can try, a different medication or just repeat the treatment. But hopefully it will work, because this time the whole family members will be treated. Thank you.